Disease specialist. And, Dr. Yasmin, I want to start with you here in Dallas. Every day that passes, we learn something new about the protocols that were in place and were not in place. Let us keep this new piece of information in perspective. She flew from Cleveland to Dallas, this new patient, before she showed symptoms of Ebola. However, should any healthcare workers who had come in contact with Thomas Eric Duncan, should they be flying at all?
Well, I think this is the question that so many of local residents are asking right now. We know that she did not have any symptoms when she was on the plane, and so that means that she was not at risk of transmitting the virus to anyone. But given now Frontier Airlines is asking more than 100 people to come forward and to contact them, that's going to increase the amount of work, the amount of resources we put into contact tracing, and it can really make people panic a lot more. So we may need to see some changes in protocols based on the idea that there is so much concern and anxiety around Ebola. Perhaps we do need to address the idea that if you are self-monitoring, you should stay within a certain area.
Dr. Esper, an infectious disease specialist, ironically enough, joining us from Cleveland today. This contract tracing brings us to the conversation about voluntary versus mandatory isolation or even quarantine. Are you of the mind that maybe if there is a question mark, when in doubt, quarantine?
You know, certainly I think the question about who needs to be identified, who needs to be monitored for 21 days to ensure that they don't develop symptoms is really dependent on their exposure and on their exposure history. And it's very difficult for us to go ahead and say to, 50 to 70 people, stay in your homes, watch daytime TV for the next 21 days. It's pretty tough, I can tell you. The issue, though, is really to try to understand the disease and what we need to do. I think the biggest problem we have right now is a perception problem. We have a perception now that we do not have this under control, that we are seeing more and more cases because of what we're not doing, and we need to reassure everyone, the people who are at risk, the people who are exposed, that we are watching them, that we are ensuring that they do not continue to spread this disease to anyone else.
Dr. Yasmin, the reason we have a perception problem, I think, is because of what has happened in Dallas over the last couple of weeks. First off, Thomas Eric Duncan was not admitted to this hospital after he went in exhibiting symptoms. Then he was admitted. Now, not one, but two healthcare workers who treated him have been infected by Ebola. So it is understandable why this problem exists. And as you point out, Thomas Eric Duncan died.
He died.
Is this hospital the best equipped now? When you are in Dallas, are they equipped to deal with the two patients that they currently have?
That's a tough question to answer, but one of the key things is we keep talking about whether we should airlift Ebola patients to these biocontainment units. We have to take a reality check, though. There are 4 biocontainment units. Between them, they have about 17 beds, and I spoke to the folks at the Nebraska biocontainment unit just yesterday. They said, sure, we have 10 beds, we're the biggest unit, but we'd only be comfortable taking 2, maybe 3 Ebola patients. So this idea that we can airlift people to a special place will quickly become redundant if those 17 beds or fewer beds become filled. And that's why it's so critical now that we learn from the missteps here in Dallas, and we make sure that every hospital in the country is ready to deal with an Ebola patient. The likelihood is if somebody feels ill, they will not turn up in Nebraska, they will go to a regular emergency room.
Right. One last question for you, Dr. Esper, as an infectious disease specialist. You know this all too well, is that, hospitals have emergency protocols in place as it stands, but Ebola is a game changer, is it not?
You know, it certainly is. Ebola is a disease that is not very forgiving of mistakes. It does not forgive the mistakes that you make when you're treating the individual patient who is afflicted with the disease, as well as in the infection control protocols that we must be stringent and we must be meticulous in protecting the healthcare workers. And unfortunately, Ebola there's still a lot that we don't know about the disease, and it's unfortunately but that we are still learning on the job. It is an important aspect of us to understand all the missteps that we have already made to ensure that in places like Dallas, but all across the country, do not continue to make those same mistakes.
Yeah, let us hope that is the case. Dr. Seema Yasmin and Dr. Frank Jesper, thank you so much for being with us. Really appreciate your help here. And as you say,